What do I love about plastic surgery? The fact that it honestly is always innovative and it never ends. We've got a lot of core subjects in plastic surgery, stuff that's pretty usual. Cosmetic surgery, breast, which includes both malignant breast reconstruction, benign breast, augmentation, reduction, lift, etc. We've got craniofacial, we've got hand and upper extremity. I mean, we've got a lot of core topics in plastic surgery. But we have these other topics that are kind of peripheral to plastic surgery, which are becoming a lot more mainstream. The ability to do, let's say, lymphatic surgery, a lot of peripheral nerve surgery, whether that's addressing headaches or innervated breast reconstruction. I mean, we've got a ton of new additions to plastic surgery, even here in Austin, where we're having our annual meeting. I've gone to a ton of different classrooms and I myself have learned a ton, clearly taking away more than what I brought because our surgery specialty is expanding. We're collaborative, we're multidisciplinary, we're cutting edge. We're not just leading edge, we're bleeding edge. That's plastic surgery in a nutshell. First of all, I don't think you can motivate anybody. I do think you can demotivate them, but I don't think you can motivate them. But the things that I personally value, and I think others do as well, things like energy, passion, enthusiasm, excitement, work ethic, grit, these are things that I think mom and dad would have taught you more than any book. And those are the things that I think, you have to be an exceptional plastic surgeon. So I would say those are the things to emphasize, probably more than anything else. What's the future of plastic surgery? My response is, what isn't? Because everything's on the field. I remember years ago, okay, and I've got my good friend with me, Tormod Westvik here, who's in Australia now. But I remember when he was a resident and we were doing the first full U.S. face transplant with Bo Pomahawk and his team at the Brigham in Boston. And I will tell you, at the time, that was a first ever, okay? Now, if you go back to first ever, how about Joe Murray, again from Boston, who's a plastic surgeon who did the first kidney transplant? That's our specialty. That's a plastic surgeon. He won the Nobel Prize for that. Okay, many people probably don't even know or recognize that the history of our specialty, that was a godfather, a grandfather of plastic surgery who did the first kidney transplant. And think about all that's come from there. So yes, we've done hand transplants, we've done face transplants. So what is the future of plastic surgery? How about the cure for blindness? How about the fact that we're working on the cure for blindness with eyeball transplants, with super microsurgery, coaptation of nerves, and anastomoses of extremely small blood vessels? How about restoring sight to those people who can't see? Plastic surgery, again, it's core, it's peripheral, and then it's everything else, because it's what isn't plastic surgery, because we are the last true general surgeons. We do head to toe, we do any gender, we go young and old and everything in between. Reconstructive and cosmetic, that is plastic surgery. What's not plastic surgery?